You're watching The Source on CNN Philippines. Now let's speak to Healthcare Professionals Alliance Against COVID-19 members, Doctors Tony and Inday Dans. Dr. Tony and Dr. Inday, thank you so much for your time. I'll start na po. Kayo ho ba nagulat pa dun sa kaso kahapon that an all-time high of over 10,000 cases?
Not really, kasi we think it's gonna get worse before it starts getting better.
And what is worse?
We have been monitoring it, and the graph says it's going up.
Can you tell us, doctors, you are expecting it to get worse before it gets better? What is worse and when is worse?
Well, in other countries, after a lockdown is called in response to a surge, it takes several weeks before it's controlled. Sometimes as long as 8 weeks or 4 to 8 weeks. So we'll need to see how fast we can bring it down for this surge in the Philippines.
Can you give us a best case scenario after this 1 week of ECQ, which is of course possible. There's a big possibility that this could be extended. But in this next couple of weeks, what are you seeing, Dr. Tony and Dr. Inday?
Well, in the next week, I don't expect much. I think it's going to go up in the next week. And maybe we'll see a decline. It will take more than just this week. What we were hoping to see this week is changes in the way we do things to prevent another surge as well as to control this current surge.
What about you, Dr. Inday?
Yeah, so we're expecting some behavioral changes because we were trying to ease our restrictions in the past few weeks. So people have the idea that the pandemic, the pandemic is under control. So people started to do things that are, that could increase transmission. So hopefully with this, it's a reminder that we're still in the pandemic and we have to really make sure that all the minimum health standards, safety precautions are followed.
But with what government has imposed, which we all know is ECQ until Sunday, possibly, of course, extended, the implementation of the ECQ, and then let's add this, the addition of those that will be vaccinated, they're just not healthcare workers, they're going to include seniors and those with comorbidities, and actually focus the vaccination in the NCR plus bubble. How big of a help would that be?
The vaccination's going to help. I think we need it now more than ever. The problem is how we implement the vaccination program. We need to make sure that there is no inadvertent crowding and inadvertent exposure during the vaccination process. But it will really help during the surge.
The three big countries that started the vaccination last December, that's US, UK, and Israel had a dramatic decline in their cases maybe 2 weeks after they had their started their vaccination programs. But most of these countries had maybe still shortage, but they have enough vaccines to cover most of their population.
And let's put it out there. How many vaccines do we have? Right now we have about 2.5, if I'm not mistaken.
Yeah, so it's not gonna go far right now. For us, we need to try and change the narrative from how soon do we start to how fast can we deliver once we start. So because the faster we're able to deliver it, then the greater chance we have of causing or affecting a decline in the numbers that we're observing.
Can I also add that the to change the narrative is saying also that vaccine is not the only answer, because even with the vaccination, especially if you have only a small percentage of the population being covered, there should be continuous protective mitigating strategies to control the pandemic.
Such as, Dr. Inday, what else can be done?
Yeah, so there are two main strategies that we propose. We know that with this ECQ, we need to re-strategize, rethink about the things that we've been doing, because obviously we're doing something missing because there's a surge. One big measure would be healthcare strategies. We've been pushing for this, a one COVID referral network, wherein as you know, patients would call, they would be directed to the right facility.
Yeah,
Yeah, not just a one hospital command, but this is more of triaging, also the primary mild cases. They know exactly where they should go. So we've been pushing for that since we called for a time out last August. The other...
And to cut you there, Dr. Inday, I wonder why we have not done that. Because in the 1 year that we have experienced this, some of us have gotten used to what COVID is, what to do when you first feel the symptoms, who are your close contacts. And then after a while, to be frank, nawawala po yung napagsanayan natin in the past, what we got used to in the past, kumbaga parang nakakalimutan natin until we got into the surge again. Sometimes some would say March, but others would actually say the surge really began in February.
Yeah. Because we are, one of the big reasons why this has not been completely accomplished is that our healthcare system is decentralized. It's decentralized, and therefore this needs a lot of integration from the local government as well as our central government, and so that will take a lot of political will to actually do that. We also lack the data management. There should be a unified data management so that we know exactly which facilities are full, which facilities can still accommodate these patients.
You are right there. In fact, when you look into what is the hospital utilization care, you would see ICU beds at 90% full, wards at 80% full, isolation rooms at so percent full. In fact, the truth is some people don't even understand ano bang isolation room, ano ba ang ward. Of course, sigurado naman alam ng tao yung ICU. And with that percentage, really, it doesn't seem to give a clear picture kung ilan na lang yung kamang natitira.
Kasi, parang kulang yung what people and doctors and nurses are feeling in the hospitals are not reflected in the data. And we think we found one missing item in our data tracker of the DOH, and that is emergency department occupancy, because the emergency department is the first to feel that surge. And so we're now lobbying for that to be included in the DOH data tracker. The emergency department in NCR are nearly 100% full.
More than 100%.
More than 100% because they filled into the lab and the parking lots.
Yeah.
So with that, we get an early warning signal that the surge is happening.
You know, in fact, what we do is we actually talk to different hospitals and ask them what the ER situation is.
Yes, exactly. So that needs to be there in the first place so that we don't need to look for this data. And we can feel what the healthcare workers are feeling. You know, hindi yung detached yung data natin from what's happening at the front line.
And you know what happens, Dr. Tony and Dr. Inday, when you really watch the news, meron pong yung mga tao, sila na yung nagdadala dun sa kapamilya nila sa one hospital, dadalhin sa pangalawang hospital, hanggang dun sa pangpito na ospital, hanggang tanggapin sila. Can you imagine the kind of stress that person, that patient, and that family has to go through?
So we have undergone that for the past week. We have been hardly sleeping just trying to get patients into hospitals. And ang problema kasi, Pinky, yung One Hospital Command Center is not able to integrate the different LGUs. So kung nagkasakit sa Makati, ayaw naman tanggapin sa Parañaque or sa Taguig. But the LGUs need to be linked together. That's what we mean by a one COVID referral network. Linking the different LGUs so that they can back up each other.
Dr. Tony and Dr. Inday, I hope that happens, a centralized command center that people can really just call. I hope it's manned properly. I hope there are enough human resources there and there's better coordination so that we know where to go in case we need to bring somebody there. Dr. Tony Dans and Dr. Inday Dans, thank you so much both for your time.
Thank you
for having us.
Thank you for having us.
Thank you. And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.